Taoiseach, this morning, many people's hearts sank with reports that level 5 restrictions are going to continue for at least another month. Infection figures remain stubbornly high, and throughout this pandemic, hospitals have consistently been to the fore in new outbreak figures. Not only are these reservoirs for infection of vulnerable people in our hospitals, but sources of new infection in our communities. These outbreaks are taking large numbers of vital frontline medical staff out of our hospitals, leaving the remaining staff struggling to provide care to patients. Taoiseach, as I've said for months now here in Leaders' Questions, we must analyse all of the available data on COVID infections and make our decisions on what that data is telling us. This data is telling us that we need to take a completely new approach to managing infection outbreaks in our hospitals. Last week, I pleaded with the Minister for Health to address the situation with regard to the management of contaminated PPE in our hospitals. I pointed out that hospitals have complained that they don't have enough bins available to them for the amount of PPE waste that has been created. With such a high rate of infections in our hospitals, it gives rise to very significant risks of infection. This week, we see from the minutes of the National Public Health Emergency Team meeting of the 10th of December that they expressed concern and sought clarity as to why mass testing was not being carried out in our hospitals where outbreaks had been detected. The HSE response to these concerns pointed out that the decisions to mass test is being taken locally by the hospital, which seeks advice from the local public health department and with involvement nationally from senior HSE management only where necessary. So in plain English, the buck stops with nobody. And when there's no one in charge, as we know, Minister Taoiseach, we have stagnation, leading to hospitals being a reservoir for COVID infection. We will never get our infection figures down unless we address this lack of leadership. And this is a position supported by NPHET, who in early December suggested that the HSE establish a national outbreak control team to ensure consistency of approach nationally to addressing hospital outbreaks and engaging in mass testing. So my question to you, Taoiseach, is there anyone in charge of controlling and minimising COVID outbreaks in our hospitals? Where does the buck stop? And can you confirm if the National Outbreak Control Team has now been eventually put in place?
Thank you, Deputy Taoiseach.
Thanks, Deputy. The buck with this obviously rests with the HSE. I don't know if the National Outbreak Team has been established yet. I will find it out for you. Just to say in general, as I think we all appreciate, the COVID situation is very serious. We're still seeing more than 2,000 cases per day. More than 200 people are in ICU, about 2,000 in our hospitals. Things are starting to fall slightly in terms of cases and hospitalisations, but not at the pace we would like. And while no decision has yet been made on restrictions, that decision will be made by Cabinet next week. I think it's fair to say that we're nowhere near where we need to be at present to ease level 5 restrictions. But of course, that doesn't mean that schools can't open in February, and there's of course the possibility of opening more construction sites because they're not supposed to be closed in a normal level 5. The Deputy rightly raises concerns about hospital clusters. We know that nursing home clusters and hospital clusters are numerous. There's a lot of them, and most deaths sadly occur in nursing homes and in hospitals. And indeed, it seems that as a third of patients in hospital got COVID in hospital. They didn't come in to COVID positive. They picked up COVID while in the hospital. Now, some of them may not be sick as a result. They may be sick for a different reason, but it still is a matter of real concern that so many people are acquiring COVID in our hospitals. In terms of what's done, the HSE is responsible, as I said earlier, and they seek advice from local public health departments as to what to do when there's an outbreak in the hospital. So Generally what happens is there's testing in outbreak areas. So if there's a particular outbreak on a ward or maybe in an ICU or in a particular part of the hospital, they do testing there. And they have done mass testing on occasion, both in University Hospital Limerick and Letterkenny, but it is hugely labour intensive and can divert from the vaccine programme and patient care and other things that, that need to be done as well.
Tánaiste, on the 3rd of November, I raised a question on a parliamentary question on the need for the establishment of a coordinated response team to ensure that we had a consistent approach to deal with COVID outbreaks. Yet when I received a reply on the 21st of December, in advance of the current surge in infection, the HSE was silent on its establishment. Tánaiste, in the first week of January, there were 158 outbreaks in our hospitals. Last week, we had a further 37 new outbreaks. Our hospitals should be about making people better, not about picking up a virus that could be deadly. You'll recall that as a result of my persistent highlighting of the COVID infection problems in our meat plants during the first wave of infection, a national outbreak control team was put in place to ensure that we had a consistent national approach in managing COVID outbreaks in these facilities. And regular testing of all staff is now taking place in our meat plants.
Thank you, Deputy.
Surely, if we can do this in their meat plants, we should be able to do it for our patients, our frontline staff, and those who sadly will need our hospitals over the weeks and the months to come.
Thanks, thanks, Deputy. I will check about the National Outbreak Control Team. I'm not sure if that has been established yet or not, but you know, I do think it is fair to say that these are healthcare settings. People in healthcare settings will tend to, many of them will have COVID, many of them will have other illnesses. They're very susceptible to COVID, and that's why infection control is so important. And hospitals, nurse managers, doctors are very well trained in infection control and have the support, for example, of a microbiology team to advise them. Like I say, when it comes to mass testing, you know, I'm not sure how practical it would be to do mass testing or serial testing in hospitals, given the number of them and the number of tests you would have to do. But it has been done in UHL and Letterkenny, where there were very major outbreaks. And what tends to be done is testing is done in the outbreak areas within the hospital, because it might be in a particular part of the hospital or a particular ward or department, and that's done on the advice of the local public health departments.
Just moving on to the Rural Independent Group.